Hello everyone, my name is Kristen and I'm a medical assistant with Dr. Wasim Hook at North Texas Diabetes and Endocrinology. This video will be a part of a series covering multiple diabetes medications. Today's video, we will be covering Pioglitazone, also known as Actos.
Patients with type 2 diabetes are generally insulin resistant, which means the cells of the body do not respond to insulin in a normal fashion. To overcome this resistance, the pancreas compensates by making more insulin. Over time, this increased workload wears out the pancreas and insulin production starts to go down. This leads to increased blood glucose levels, which generally gets worse with time. Pioglitazone belongs to a group of medicines called TZDs, or thiazolidinediones. TZDs reduce insulin resistance, which simply means they help insulin work better in the muscle, fat, and liver cells. This helps prevent buildup of glucose in the blood. By reducing insulin resistance, these medicines can be useful in reducing the workload of the pancreas. This diagram on the left illustrates the relationship between insulin resistance and insulin secretion in a typical patient with type 2 diabetes. As you can see, insulin secretion cannot keep up with the demand that this level of insulin resistance places on the pancreas. Therefore, the blood glucose level rises. With TZDs, in the diagram on the right, the insulin resistance is reduced. Thus, the same level of insulin secretion is able to keep glucose levels in normal range. Over time, by reducing the workload, TZDs can stabilize diabetes control over a longer period of time than many other diabetes medicines. TZDs improve fasting glucose as well as glucose levels after meals. Because it does not affect insulin release, by itself, it does not cause low blood sugar. TZDs may cause increase in weight while improving diabetes control. It is known that visceral fat, which is the fat that wraps around internal organs, is more dangerous than subcutaneous fat, the kind that lies just under the skin, around the belly, thigh, and buttocks. This is because the visceral fat releases chemicals that can cause or worsen insulin resistance. In addition, visceral fat promotes inflammation, which can lead to cardiovascular complications of diabetes. TZDs lead to a decrease in the visceral fat, but unfortunately can increase the subcutaneous fat. Your doctor will generally use the lowest effective dose to minimize this weight gain. A strict diet and active lifestyle can also prevent weight gain in most patients. This slide presents the most common pioglitazone preparations and their doses available in the United States. Pioglitazone is typically started at the 15 or 30 milligram dose, usually taken in the morning after breakfast. It may take 6 to 12 weeks to see maximal effect on glucose readings. Pioglitazone can make you more sensitive to insulin or diabetes medicines that work by releasing insulin through the pancreas. Because of this, you may experience hypoglycemia when using pioglitazone in combination. If this happens, your doctor may advise you to reduce the dose of these other medicines. In contrast, the combo of pioglitazone and metformin does not cause low blood sugar. The most common side effects of pioglitazone include weight gain and fluid retention. Other rare but serious side effects include increased risk of fractures in older patients, rare occurrence of bladder tumors in those who have taken it for a long period of time, and macular edema. Although pioglitazone has certain advantages over other diabetes medicines, such as low risk of hypoglycemia, low cost, improvement in blood lipids, and potentially more durable control of diabetes. However, it is not appropriate for certain patient groups. Patients with significant heart disease or congestive heart failure are particularly at risk of fluid retention, which may worsen their heart condition. Other groups identified in this slide should generally not be prescribed pioglitazone. Despite the risks we previously discussed, pioglitazone can be useful in certain patients with diabetes when used appropriately. Pioglitazone has the potential to slow down diabetes progression, particularly in patients with severe insulin resistance. It can also improve fatty liver, which is quite common in patients with diabetes. Patients with diabetes tend to have high levels of triglycerides, and pioglitazone may help reduce these levels. Pioglitazone is now available as a low-cost generic in the United States, making it affordable for most patients.
This video is for informational purposes only and is not intended to serve as a substitute for medical consultation or treatment. Please contact your healthcare provider about any questions or concerns pertaining to your specific condition. They would be able to provide you with answers and recommendations that are specific and accurate for you. Good luck, and thank you so much for watching.